Jess here. Today I'm going to be going over the biomechanics of kicking a soccer ball, as well as going over the common injuries that might happen within this movement. At the time, I do not have access to a soccer field nor a soccer goal, so we are just demonstrating right here in my backyard. Okay, before we start breaking down the movement of kicking a soccer ball, there's something important that I want to point out, and it is that kicking a soccer ball requires the whole body to work together in order to make this movement successful. So your feet, your legs, your hips, your trunk, your shoulders, and your head all need to play along in order to have proper form and balance during this whole entire movement. So kicking a soccer ball has 4 important phases. It is the approach, the foot plant, the strike, and the follow through. So let's get right into it. So what happens first during this movement is the approach, which what takes place is you basically are having a running start to the ball. So what happens here is that you're running towards the ball, you use the momentum to stabilize the trunk and the lower back during the approach. The muscles that are used here is the rectus abdominis, psoas major, and the erector spinae to keep you nice and erect during this movement of running. The next phase is the foot plant. So after the approach, you'll plant your foot. Once you plant your foot, basically the muscle that is helping you stay balanced and stabilized here is the flexor hallucis longus, which is just your big toe, ensuring that you don't fall over during this short period of time. After the foot plant is the ultimate strike. So there's a lot that goes on in the strike. So from the approach, foot plant is the strike. So basically you can come at the strike at any different angle, but I'm just gonna come out at this angle. So approach it, foot plant, and the strike. What happens here is that you're extending your hips, so hip extension. You're internally rotating your hips as you kick the ball, and then you're having some sort of hip flexion, and then knee extension, which we'll go into that in the follow through as well. So I want to point out that the strike mainly is all your muscles working together to transfer the force to the ball. So this is how you get the power in the kicking. So during the hip extension, which is like this, you're extending your hips like this to get the power. It's mainly your gluteus maximus, and then all your muscles in the back. So bicep femoris, semitendinosus, and the semimembranosus, that gets that power transferred to the ball. The next muscles that happens is the internal rotation. Once you bring your hips back, you internally rotate them. That is the tensor fasciae latae, rectus femoris, the psoas major muscles, and the adductor muscle groups. So during hip flexion is basically the move of going like this before you extend your foot to kick. So these muscles are the tensor fasciae latae, the rectus femoris, psoas major muscles, and the adductor brevis, the longus, and the magnus. So they all work together in order to have that hip flexion happen, which is mainly where the injury is related, but we'll go on to that later in the video. The fourth and final phase is the follow through. So to break it down, the approach, the foot plant, the strike, and the follow through. So mainly what happens here is knee extension. Lumbar flexion happens sometimes. So sometimes you would kick the ball and then have little lumbar flexion, and then obviously plantar flexion in the foot. So to start with, knee extension, the strike, there is the rectus femoris, the vastus lateralis, vastus medialis, and the vastus intermedius that works together in order to extend the knee. From there, the lumbar flexion happens in some cases, and that is the erector spinae, the whole trunk muscles, which is the obliques, and then the rectus abdominis. And lastly, plantar flexion, which is like this. So you kick like this, which you're having a plantar flexion in your foot. this is the gastrocnemius and the soleus that works together in order to create that movement. From the anatomy aspect of kicking a soccer ball, I want to point out the importance of the common injuries that happen in this sport, for it has the most effect in this class of the sports injuries aspect. The most common injuries that happen in kicking a soccer ball is within the hip flexors. So everything involving hip flexors, there's two main injuries that happen the most, which is there is the adductor tendinopathy and the iliopsoas tendinopathy. So since the hip flexors is the most common injury that happens within this movement, I want to go over first the adductor tendinopathy, which is right into here up to your groin. So these muscles right here are mainly affected because of the repetitive strain that happens of repetitive kicking. So keep kicking, that's all a soccer player will do. And what happens is that repetitive strain to the adductor muscles from the excessive kicking turns from tendinitis into tendinopathy in some extreme cases, but it happens and it's a more degenerative process. Now the iliopsoas tendinopathy, it's mainly in here, but it's said to be the most one of the most strongest muscles, but it still can't take the pressure, which basically says something. So the repetitive hip flexion, which happens in soccer, again begins as tendinitis and then shows a degenerative frame of the tendon. So basically, if you were to do an ultrasound, because you have hip pain, when you're a soccer player kicking a ball, you might have hip pain. They'll do an ultrasound, they'll see some degenerative frame within your hip flexors. And this is a big reason that this injury occurred. So from these injuries, it's basically spraining it, straining it, tearing it, and overusing your hip flexors, and that is why it's a common injury within the sport. Common mechanisms of injury is having tight muscles, poor flexibility, the over kicking, not enough rest, and years of improper care. So being able to repetitively kick every single day. If you're an athlete, that's all you do is kick. No rehab, no rest, nothing like that. It'll cause some type of injury within the hip flexor. That is the 4 movements of biomechanics of kicking a soccer ball. I'm Jessica. Thanks for watching.